Hello everybody, I'm Dr. Khyati Shah, an obstetrician and gynecologist. My today's topic is PCOS. I know it's a super relevant and rampant disease. Actually, I would say the world is suffering with an epidemic of PCOS. Almost 20% of the patients that we get in the OPD have PCOS. Now, what exactly is PCOS? It means Polycystic Ovarian Syndrome. The word is syndrome. That means that it affects all systems of your body from head to the toe. Why is PCOS exactly happening? There is continuing research on the same. We don't exactly know the cause, but we know that there is a two-hit hypothesis, which means that if you have a genetic predisposition, if you have a family history of PCOS, there is a likelihood that you will also have PCOS. The second hit is the environmental causes. That means that your lifestyle is probably making you affected with PCOS. What happens in PCOS exactly? So, there is a rise in the male hormones, what we call as the androgens in the body, which prohibits the ovary to secrete the egg. That means there is continuous estrogen in the body and no regular menses. That is the reason why PCOS patients have prolonged menstrual cycles followed by heavy menstrual bleeding, usually after a span of 2 months. Now, why is PCOS so scary and relevant? As I said, in PCOS, there is a continuous estrogen exposure in the body. Now, our body has been designed beautifully by God in such a way that there is a cyclical variation in the hormones. If there is an imbalance, that is in this case, and a continuous estrogen exposure, it leads to infertility, it leads to fibroids, it can also lead to scary things like the ovarian and the endometrial, which is the uterine cancer. PCOS is associated with insulin resistance. Now, what does that mean? That means that your body cannot use its own insulin effectively. It cannot absorb its own glucose. Prolonged insulin resistance leads to diabetes. So, if your PCOS goes untreated, it predisposes you to obesity, diabetes, and long-term complications of the heart and the brain. We have heard about all of this. Now, let me tell you symptoms about what you should look out for when you are talking about PCOS. I'll start from head to the toe. So, it can lead to hair thinning, which basically means that where you do your hair parting or at the crown, there will be thinning of hair. This is because of raise in androgen levels, that is the male hormones. There will also be increased acne on your face. There will be increase in facial hair. So these patients might have more hair on their upper lip or on their sides. On the neck, there will be something that we call as acanthosis nigricans, which basically means darkening of the nape of the neck. This is a specific indicator for insulin resistance. There also may be tender breasts. There may be central obesity, that means a lot of fat around your tummy region. Now, central obesity is harmful because that fat leads to diabetes. In your ovaries and in your uterus, there will be irregular menses. That means there will be a cycle which lasts for around 5 weeks, 6 weeks, followed by heavy menstrual bleeding. This is because the eggs are not being released from the ovary. Now, this can also lead to infertility cases in the future. Now, I want to do a 2-part series about this because there is literally so much to cover on what do you do if you are experiencing such symptoms, when to go to the doctor, and if you go to the doctor, what should you expect? What are the treatment protocols? All of that will come in the next video. Thank you.